Hello everyone, this is Dr. PJ. If you are interested in lifting treatments, you probably heard of Shurink before. Today, I'm going to walk you through everything at once. From the differences between the original Shurink and Shurink universe, to the effects, who it's best for, and even the possible side effects. Shurink is the lifting device that uses HIFU, which stands for High Intensity Focused Ultrasound. A simple way to understand it is to think about using a magnifying glass to focus sunlight onto one point. In a similar way, Shurink focuses ultrasound energy into the smashed layer beneath the skin, creating tiny thermal coagulation points. When this heat is generated, the tissue contracts instantly, helping lift sagging skin and create a tightening effect. Then, during the healing process, it also stimulates collagen regeneration. Another important point is that Shurink can target different depth depending on the tip being used. The 1.5mm tip targets the superficial dermis, the 3mm tip targets the mid layer, and the 4.5mm tip reaches the smashed layer. So, in other words, it's a device that allows us to customize the treatment depth based on each person's skin condition and facial structure. The effects of Shurink can generally be divided into two categories: immediate effects and long-term effects. First, let's talk about the immediate effects. Right after the procedure, the heat causes the tissue to contract. So many people notice that their skin feels tighter right away. In particular, patients often say their jawline and cheek contour look more defined immediately after treatment. The second type is the long-term effect. This is actually the most important part of Shurink. The real collagen remodeling process typically peaks around 1 to 3 months after the procedure. That's because the heat-stimulated tissue gradually heals and produces new collagen over time. So, as the weeks go by, many people notice improved skin elasticity and a more noticeable lifting effect overall. As for the recommended treatment interval, if you're doing it mainly for maintenance, treatments are usually done every 3 to 6 months. But if more intensive management is needed, some patients may undergo treatments every 2 weeks, similar to protocols used with mode. Of course, this can vary significantly depending on factors like facial fat volume and skin thickness. One of the most common questions people ask is about the difference between the original Shurink and Shurink universe. And there are really 3 major upgrades. The first is the MP mode. With the original Shurink, the energy was delivered more like separate dots spaced apart. But with Shurink Universe, the energy is divided into very fine micropulses and delivered in a more continuous line-like pattern. This allows the heat to spread more evenly, which can create a stronger lifting effect, especially in areas with thicker fat or more sagging. And because the energy is distributed into smaller pulses, many patients also feel that the treatment is less painful compared to the original version. The second difference is the treatment speed. Shurink Universe is significantly faster than the original Shurink. That's because the original device delivered energy in only one direction, while the Universe system can deliver energy in both directions. In real clinical settings, a 300-shot treatment can be completed about 2 to 3 times faster than before, which also makes the procedure much more comfortable for patients. The third upgrade is the booster tip. Compared to the original handpiece, the new pen-type booster tip is much more precise. It allows us to treat curved and delicate areas, like around the eyes, mouth, nasolabial folds, and double chin, with much more detail and accuracy. So overall, Shurink Universe allows for a much more customized and precise lifting treatment than before. So, who do I usually recommend Shurink Universe for? In general, it works especially well for people who have a bit more facial volume and are concerned about sagging. For example, if your jawline is starting to lose definition or the deep cheek fat has begun to descend and make the face look heavier overall, Shurink Universe can be a great option. It can help tighten and compress the facial contours, giving a more defined jawline and an even slimmer looking facial appearance. On the other hand, people with very little facial fat should be a bit more cautious, because Shurink can also affect the fat layer. patients who already have a lean face may end up looking slightly more hollow or tired afterward. In those cases, treatments focus more on skin tightening, like Thermage, or skin boosters that improve overall skin quality and hydration may sometimes be a better fit. This is probably one of the most common concerns patients have. To answer briefly, most side effects can be minimized or prevented when the treatment is properly designed by an experienced provider who understands facial anatomy well. One of the biggest concerns is facial hollowing. If too much fat is reduced under the cheekbone area, the face can start to look hollow or tired. But in most cases, this can be avoided by carefully avoiding high-risk areas during treatment. Another important point is nerve safety. In areas like around the mouth, where nerves run more superficially, deeper tips need to be used more carefully. For example, using the 4.5mm tip aggressively in every area is generally not recommended. Some patients also worry about line-shaped marks or burns after treatment. This can happen if the tip is not fully in contact with the skin while delivering energy. However, when the practitioner carefully maintains proper contact during the procedure, this is not a common side effect in real clinical practice. The real advantage of ShurinkUniverse isn't simply that it's a newer device. What really makes it different is that it allows for a much more customized and detailed treatment design based on each patient's facial structure and skin condition. For example, in areas with heavier sagging or thicker fat layers, we can use the MP mode more aggressively to create a stronger lifting effect. On the other hand, in areas where facial hollowing is a concern or where nerves are located more superficially, we can safely approach the treatment using the dot mode instead. And for curved or delicate areas like around the eyes or mouth, the booster tip allows for a much more precise and detailed treatment. So, rather than using the exact same technique across the entire face like before, ShurinkUniverse allows us to combine different modes and treatment depth depending on patient's individual facial anatomy and skin condition. Lifting treatments are not simply about using more shots to get better results. What really matters is how precisely the treatment is designed, which areas are treated, at what depth, and with which mode, based on each person's facial structure. That's why I always recommend consulting with an experienced provider to create a lifting plan that truly fits your own face and skin condition. If today's video was helpful, please don't forget to like, subscribe, and turn on notifications. This was Dr. PJ. Thank you for watching.